The resonance metallic ureteral stent set is used for temporary stenting of the ureter in adult patients with extrinsic ureteral obstruction. The stent can remain indwelling for up to 12 months. If the patient's status permits, the stent may be replaced with a new stent. To place the stent, first insert a wire guide cystoscopically through the ureter, past the obstruction, and into the kidney. Next, utilizing fluoroscopic guidance or direct vision, pass the introduction catheter and sheath over the wire. The sheath has a radiopaque tip to aid placement. Remove the wire guide and introduction catheter simultaneously to allow for passage of the stent. Use the pigtail straightener to introduce the stent into the sheath. Use the introduction catheter to advance the stent through the sheath until the numbered marker, corresponding to the stent length being deployed, reaches the hub on the sheath. At this point, the first pigtail will have fully deployed from the sheath. Retract the sheath. As you remove it, hold the introduction catheter in place to prevent further deployment of the stent into the kidney. When the hub of the sheath aligns with the proximal ink mark on the introduction catheter, the second pigtail is about to deploy. At this point, retract both the sheath and introduction catheter completely. The resonance stent is made of a cobalt chromium nickel molybdenum alloy. An internal wire of the same alloy extends the full length of the stent and joins the stent at either extremity. This wire prevents the elastic elongation of the stent. The stent's tightly wound coil design helps maintain continuous drainage by allowing urine to flow in and out of the coils. Conventional cystoscopic techniques using forceps or graspers can be utilized to remove the stent.